Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
This is Lindsay Smith-Rogers. Water fluoridation is considered one of the 20th century's greatest public health achievements. Yet for as long as there has been fluoride in the water, some have raised concerns about its safety. In this episode, Stephanie Desmon talks to Dr. Charlotte Lewis, a pediatrician and an expert on infant and child nutrition and oral health at the University of Washington, about the history of water fluoridation, its enormous benefits for preventing tooth decay, and the recent wave of interest in whether fluoridation policies should change. Let's listen.
Charlotte Lewis, thanks so much for joining me. Today, our topic is fluoride. And this is something you have studied for a long time. And I'm wondering if you could start by explaining to us really basic, why is there fluoride in the water? And how many people have fluoridated water? And what are the benefits?
Yeah, those are some really good questions. In order to really answer that question, we have to take sort of a historical perspective, and we have to go back maybe 100 or so years. And at that time, dental caries, which may be referred to as dental decay and cavities, were very prevalent, and they impacted pretty much the entire population. And because of that, there was a lot of tooth loss that happened in kids. There was toothaches, there was abscesses that were happening related to very extensive dental decay. That was pretty much a universal thing. The problems with dental decay continued into adulthood, and they left many, many Americans with no teeth at all. This was really an enormous problem in the first part of the 20th century, a very, very prevalent, costly condition that was causing a lot of suffering. So there was big questions about how might we prevent cavities, and no one knew the answer to that. And the only thing people could come up with was sort of prophylactically filling teeth to keep them from being affected by cavities. In about the 1930s, there was some researchers who had been looking at why there were some individuals in certain parts of our country that didn't have as much dental decay. And they also had some modeling or staining to their teeth, and they were wondering kind of what the connection was there. And ultimately, through these researchers' efforts, what they found was the reason why there was less decay in some parts of the country, like, for example, some of this original research was happening in Colorado, was because fluoride was naturally present in the water and people were drinking it. At very high levels of fluoride intake, you can get some erosion of the enamel of teeth, and then that predisposes to staining from things like drinking coffee and tea and things like that. That is what they were seeing. They were seeing these very high intakes of fluoride that were leading to some of this staining, but they noticed that if you went slightly lower in the levels of fluoride that people were taking, what you saw was primarily just caries prevention. And so that was this revelation that was sort of transformative to the oral health of our country, because based on that research, they then looked at other cities around the United States that had naturally present fluoride in the water. And those concentrations varied. So from 0 to more than 4 parts per million of fluoride. And just for reference, our current recommended amount of fluoride in community water fluoridation is 0.7. And what they did was they did this very elegant but simple epidemiologic work that showed this very clear relationship between the amount of fluoride naturally present in the water and the caries levels in those communities. And so there were people already benefiting from fluoride in the water even before we had community water fluoridation. And so some other researchers looked and said, well, where is that kind of sweet spot where we can optimize dental decay prevention but not cause side effects? And the biggest side effect that people were concerned about at that time was dental fluorosis. And so dental fluorosis, just like many things, is dose dependent. And so at low doses, it may just cause like these little white specks on the teeth. things that are not very noticeable, but those teeth are more resistant to dental decay. As you get to higher and higher doses, like some of those communities were exposed to prior to them really understanding why it was that they had the stained teeth, then you can start to have more adverse effects. And in some parts of the world where there's very, very high levels of fluoride in the environment, you actually have a chronic condition that develops that's called skeletal fluorosis, which basically is very brittle bones. And we don't see that sort of fluorosis in the United States. What we see in the United States is primarily very mild fluorosis, which is just those white specks on the teeth and being more resistant to cavities. So that's sort of some background about how we got to a place where we understood why fluoride in the water helps to prevent cavities. And then there's been substantially more research that's been done to kind of better refine our understanding of that. But the bottom line, or the thing that I want people to realize, is that the reason why we know that fluoride is effective is because it's naturally present in the water around our globe. And there's more than 50 million people are already drinking water that's 1 part per million, because it's naturally present in their water. So this is not something that, is added or a pollutant or something like that. It's already there.
So my understanding is about 72% of municipal water systems in the U.S. have fluoridated water, and that the CDC declared that water fluoridation was one of the 20th century's greatest public health achievements, pointing to the dramatic decline in cavities and tooth decay. So it's like vaccines, it's sort of a big part of public health history. Now we're hearing a little more about concerns about fluoride in the water. And I know that there's been conversations about this for a while now, but it's come to the forefront because President-elect Trump has said that he will make Robert F. Kennedy Jr. the health secretary, and he wants to take the fluoride out of the drinking water. So I wonder, when you hear that, what do you think?
Well, I think that those sorts of comments have been around for a long time. And certainly trying to connect fluoride in the water to health risks is not new. That's been going on for decades. And over again, those potential connections, for example, hip fractures or bone cancer, those have all been disproven. Those were all things that were very much brought to the forefront of the public's concern, and through really robust research were disproven. And then we now know that community water fluoridation does not cause those problems. Now, the more recent concerns that have arisen have come from concerns about impact on neurocognitive development based on fetal exposure and early childhood exposure to fluoride. I think we don't know what the exact dose would be that would cause those problems. We know somewhat, but the quality of the studies is not good, that when you're in environments such as in India and China and Iran, where there's very high concentrations naturally present in the soil, that there can be an increased risk. It's hypothesized of a neurocognitive effect of very high exposure of fluoride. It's hard to say definitively because those studies are not great quality. So based on that, concerns then spread to lower levels of fluoride exposure and even to the kind of fluoride exposures that we use for community water fluoridation, which are quite a bit lower than, what was originally seen in Colorado or what's seen in these other countries now. And so where this really started to take off was when there was an article published late in the 2010s with first author named Green. And he conducted some epidemiologic analysis based on some cities in Canada and ended up concluding that fluoride exposure early in development could decrease IQ in boys. And so that paper was published in a prominent pediatric journal and got a lot of press. I think that's where a lot of these concerns really took off. However, there's a lot of problems with that particular study, and subsequent studies have not shown that same effect, and in fact have shown the opposite effect. And also there's been population-based studies, which we know do a much better job at establishing cause and effect. that have shown absolutely no effect on neurocognitive development or IQ scores, and in fact have shown that actually on an economic analysis, if you have fewer cavities, it appears you're more likely to be successful in life and to attain higher earnings in adulthood. So there's even been some work showing that it's quite beneficial to have exposure to fluoride in the levels that we see in community water fluoridation. But those haven't really gotten the same attention. And unfortunately, what did get a lot of attention was this report by the National Toxicology Program, which is also a problematic document in that this is the third attempt at it. The two prior attempts underwent peer review by National Academy of Science, Engineering, Medicine, and they basically said, this is not good science. And you guys need to go back to the drawing board and redo this because you're relying on studies that are poor quality and you're making conclusions that are not supported by the research. So on their third attempt, they did not take it in a SEM, and instead it went to Judge Chen in San Francisco. And he relied heavily on that report, quoting it more than 100 times, which is really unfortunate because while he may understand the law, he does not understand the science here. Even though that report was explicitly said in that report that it was not meant to apply to community water fluoridation. It was not meant to apply to levels below 1.5 parts per million. Still, he drew conclusions from that report that something needs to be done to change this and that fluoride in the water is risky to health. I think that is not a valid conclusion from the work. And I think it's unfortunate because that's really what's kind of brought this to the forefront.
Do we need fluoride in the water anymore? I mean, we have access to fluoridated toothpaste. We have access to more dental work. I mean,
well, I think there's a number of advantages to community water fluoridation. And what those include is that it's a relatively passive public health intervention, and that just by adding it to the water supply, it's available to everyone who drinks water. And that's essentially everyone. Everyone has to drink water. Other strategies that have been tried, like in some Scandinavian countries, they don't have community water fluoridation, but they have a very robust system of starting toothbrushing in early childhood education and schools and things like that. Their access to dental care is substantially better than it is for some parts of our population in the United States. It's also very hard for, as a pediatrician and also as a mom, I can tell you it's very hard to brush an infant or a toddler's teeth adequately. That takes time, it takes effort, and when you have a lot of competing priorities, it's not something that necessarily happens the way that it should for young children. So the important advantage to community water fluoridation is it's available to everyone, regardless of their access to dental care. It's also available to everyone, regardless of their ability to routinely participate in home oral hygiene practices. So that, I think, is why we've seen it be effective, particularly in eradicating some disparities in oral health, which are pretty pronounced in the United States. So I think the question about whether or not it's still needed is a good one. The problem is that if you don't consider the historical perspective, just like if you don't consider the historical perspective when it comes to vaccines, you may be led to believe that these things are no longer problems. So you may be led to believe, well, I don't really see that much measles or polio, must not be that big of a deal. However, what you're doing is ignoring the fact that we already have a very robust system in place to try to keep those issues as low as possible. And so particularly when it comes to water fluoridation, what the discussion is missing is that right now, yes, let's say 2/3 of the population is supplied by a public water supply that has fluoride in it. The reason that number is a little bit different than the 72% that you quoted is not everyone is on a public water supply. So what happens, though, is that many manufacturing plants and things like that produce beverages like juices, which they reconstitute with community water that has fluoride in it, soda pop, all of these things are now unlabeled sources of community water fluoridation. And those have diffused from centers where there's community water fluoridation present into areas where it's unfluoridated. And because of that, we've seen a smaller difference between communities with and without community water fluoridation in terms of cavity levels. Whereas in the initial studies that they did in the 1940s, you saw a 60% drop over a period of just a few years in terms of the amount of cavities that was occurring in children. That's still very valid and important research because during those studies, there was no other sources of fluoride. There was no fluoride supplementation. It wasn't diffusing into other communities, and fluoridated toothpaste wasn't commercially available till the early 1960s. So those studies really do show the dramatic effect of having fluoride in the water, and the 60% drop in cavities was an incredible achievement, which is why the CDC was accurate in describing that as an enormous public health accomplishment. It may seem like we don't need fluoride anymore, but in reality, it's everywhere. We're drinking it, and it won't, just by removing it from the water, the impact of that, there will still be some people who will benefit from fluoride, for example, in toothpaste, but there'll be a lot of vulnerable populations that will suffer because of that. And we've seen that in some studies, for example, Calgary and Edmonton, two Canadian cities where Calgary discontinued their fluoridation program in 2011, and over a relatively short period of time saw dramatic increases in cavities in kids, and the number of kids who were requiring IV antibiotics, who were needing operative dental care under general anesthesia, increased quickly with removal of the fluoride from the water. So it's not a good thing for us to be contemplating, and I believe ongoing use of community water fluoridation is safe, because it's at a low enough level that we know that it's advantageous to be drinking it at that level and not dangerous based on the research that we have.
Charlotte Lewis, thank you so much for joining me.
It was my pleasure to talk to you, Stephanie. Thanks for asking me about fluoride.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith-Rogers, Stephanie Desmon, and Grace Fernandez-Ciceri. Audio production by J.B. Arbogast, Holly Cardinale, Spencer Greer, Matthew Martin, and Philip Porter, with support from Chip Hickey. Distribution by Nick Moran. Production management by Catherine Ricardo. Social media run by Grace Fernandez-Ciceri. Analytics by Eliza Rosen. If you have questions or ideas for us, please send us an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.